transducer sitting underneath a water bath. And so as the patient runs in, the transducer's below here being controlled by the computer that focuses in 2 millimeter steps. And it just goes through. It's commonly used for fibroids, but it will be used, I think, more and more for cancer. These techniques, though, are also can be integrated with other particles. So instead of just having the focused ultrasound, one can have particles circulating in conjunction with ultrasound. So in this particular case, you have low temperature, heat-sensitive liposomes. What is that? Well, those are basically liposomes that include a lipid in them, maybe a plant of origin, that really is destabilized when it warms up. It changes the packing chemistry, if you will, of the membrane, and therefore what's inside leaks out. So using ultrasound, where you would normally have maybe very small leakage, let's say through angiogenesis, which has very small leakage, with heat, you can increase the permeability, as we saw for the fluorescent nanoparticles, and with heat, you can stimulate the release of the liposomal contents by disrupting their membranes, actually disturbing their membranes. In other cases, you might use a microbubble. Now, this is cell culture, some work done by Nico de Jong in the Netherlands, and you see here 2 cells. Here's a cell, and here's some bubbles in between. So what you can do when you give ultrasound to bubbles is they cavitate like a balloon. So depending on where you are in the RF cycle, you're expanding or you're compression, right? So these things can oscillate, and in that process, they can either be cavitate to disrupt the membrane, or even just oscillating can disrupt the membranes they're against, and they can